Okay, hello everyone, and thank you for joining us today in this town hall meeting. As I have previously mentioned, we really want to have these Thursday town hall meetings. Please mute yourselves if you have any background noise. What we really want to do with these town hall meetings, and this will start next week actually, for the next 8 consecutive weeks, we are going to be discussing different topics in regards to rebuilding our physical therapy practices. You see, and I have been speaking with a lot of roundtables and town halls and webinars, and the thing that I have been saying time and time again is that, look, the time that cried on each other's shoulder and the time we were so needy about sympathy about what has happened to us is over. Okay, so, and I have all the right to say that. I am not speaking to you from some remote little village with, 150 residents there. No, I am speaking to you from ground zero, from New York City. So 1/3 of the cases are here in New York. 1/3 of the deaths are here in New York. And when I'm saying that the time has come now to start really figuring out the next step and the future of the physical therapy operations and the adjustments that we need to make as a physical therapy profession and the environment adjustments that we need to make, they're all very important. And besides individual initiatives like this that we have taken, of course, we have very, very important initiatives that have been taken by the leadership of our profession and our association, the American Physical Therapy Association, that has been really tackling these issues from many different viewpoints and caters to the needs not only of those physical therapists who are in private practice, but also of the needs of every single physical therapist in the different environments that they are working on. If you go to the APTA's website, apta.org, you are going to find a lot of information there. Those of you who are also private practice owners, the PPS APTA website is an invaluable source of information. They have checklists, they have information about how to handle your finances, they have Excel spreadsheets. I have to tell you that in our businesses, we are using, let me just mute people one more time. In our businesses, we have been utilizing these resources, the APTA resources and the PPS APTA resources all the time. Also, before I introduce our today's guests, I sincerely want to thank you all for participating in this initiative. This is a community grassroots initiative, ptforheroes.com, where the physical therapists who participate in this program, we are offering free physical therapy visits to those people on the front lines of COVID-19, to the doctors, the nurses, the healthcare professionals, and their families, okay? We have even pediatric therapists who are helping, PTs, OTs, and SLPs who are helping in this direction. And here you can go and share your stories. We have lots of individual therapists and practices who are participating across the nation. This has been a tremendous grassroots movement. Even if you go to the area of resources and the area of media, you're going to see that we've had a tremendous media exposure, a lot more than what we have listed here actually, of these efforts. This is you out there really giving the message that our professions, PT, OT, and speech, can offer very, very valuable services to society, starting with our people in the front lines of COVID-19. But I am so happy today to have in this town hall meeting two very important individuals, and I will not say important only because of the position we have within the American Physical Therapy Association, but they are very important because they have been themselves in the front lines of safeguarding our profession and helping to shape via rules and regulations that they guide the future of our physical therapy profession. So I would like to welcome Kara Gaynor, who is the Director of Regulatory Affairs of the APTA, and Justin Elliott, who is the Vice President of Government Affairs of APTA. Kara and Justin, welcome, and thank you so much for joining us today.
Well, thank you, and appreciate the invitation to join you all today. And thanks to everyone on the call taking time to join this town hall as well. And really want to just first say thank you for the work that you all are doing on the front lines of this pandemic. The situation has not only impacted our country and the patients we serve, but is going to have lasting effects on the profession and how we practice and how we're getting paid. And so appreciate on behalf of APTA just the work that you all are doing during these very difficult times. And so again, appreciate the opportunity though to talk about one element that has really been on the front lines, and that's telehealth. And some dramatic changes we have seen since early March on telehealth, both for the healthcare system and particularly for physical therapy. And what's interesting is that this pandemic has really quickly evolved telehealth. Some of the things that have been implemented just in the last 6 weeks, we did not expect to see the federal government implement probably from 5 to 7 years from now. And so we are seeing a very quick evolution, a very forward push of telehealth across the spectrum in healthcare that we didn't expect to see for a number of years. And so what we're seeing now is just trying to make sure that we're able to primarily also make sure that physical therapists and physical therapist assistants are able to utilize telehealth, something that APTA has been working on for a number of years, and one that we are particularly now, when right now we need to be able to use telehealth, particularly for Medicare, because it is so critical. And there's been a lot of work both on the private insurance, but with Medicare is our one that we've been doing a lot of focus. So I was first going to turn it over to Kara, who can provide an update on some of the issues, particularly with CMS and some of the confusion that's been coming out of CMS on this, because there's been some communication from CMS that has been not necessarily helpful, and some of the things with the codes, which has been confusing and contradictory. So we're going to give a little bit of status as to what the status is right now today with CMS and what we foresee happening in the very near future in terms of CMS, but then also looking at what is our long-term strategy here, because right now everything that CMS is doing is being done through emergency waivers because of the declared national emergency. And once the emergency is declared over, whether it's 3 months from now, 6 months from now, a year from now, or whenever, those emergency waivers go away. And so we still need a long-term solution to telehealth, and one that Congress needs to enact, and one that we're also working on. So Kara, I'm gonna, if it's okay, I'm gonna turn it over to Kara. And
yeah,
provide
absolutely. And I would say, Justin and Kara, if you don't mind, because we have people joining the meeting that some of them may have been kind of up to date on things, but also some people may have not. If you can just give us like a little bit the history in terms of what has happened and what is the current status and how we're moving in the future. Thank you.
Absolutely.
Sure. So hi, I'm Kara Gaynor, APTA's Director of Regulatory Affairs. And so I'll give you an overview of the timeline when it comes to the federal government and Medicare, and then I'll turn it back to Justin to talk about timeline and our activities on the Hill in relation to legislation as it relates to telehealth. So just for some background, you know, as Justin mentioned, telehealth has been a priority of APTA for quite some time. And in light of COVID-19, certainly there was a significant increase in interest in ensuring that Medicare would allow coverage for telehealth services. And so the fact of the matter is that CMS, the Centers for Medicare and Medicaid Services, which administers Medicare, does not have the statutory authority to simply add therapists as telehealth providers. And so Justin will go into a discussion of how we're trying to give them the permanent authority to add therapists as telehealth providers. But when a public health emergency was declared on March 13th by the president, that gave CMS the authority to make a number of changes to regulation and policies in accordance with what is termed as their 1135 waiver authority. And that is a provision within the Social Security Act that gives CMS authority during public health emergencies to waive certain regulations to afford providers flexibility in delivering patient care. And so on March 13th, you saw CMS invoke that authority, and in accordance with what is currently outlined in statute, they made a number of policy changes unrelated to telehealth, because as previously under the previous statute, there was nothing in the statute related to telehealth. It was written quite some time ago, before telehealth was really at the forefront of how care could be delivered. So that was March 13th. Then and the policies that they implemented as a result of the public health emergency were made retroactive. And then on March 17th, you saw CMS release information related to the coronavirus stimulus package that was passed in early March, in which they made, in addition to a number of other changes, they made some tweaks to the telehealth statute and essentially waived some of the restrictions on where patients could receive telehealth. So thereby, CMS through Congress then had the authority to add a patient's home as an originating site. And so patients, obviously we know a lot of patients are staying in their homes right now. And so Congress gave CMS the authority to allow Medicare reimbursement for telehealth furnished to patients in their homes. And so that was on March 17th. And on the same date that they made that announcement, CMS made the announcement that they would be making some flexibilities and changes related to virtual check-ins and remote evaluation of pre-recorded video and images and e-visits. And in relation to the e-visit codes only, on that March 17th date, CMS said, we will allow physical therapists and OTs and SLPs to furnish e-visits and bill for them using codes G2061 through G2063. And they didn't release a lot of other information other than what was in that fact sheet. And so at that point in time, those codes were actually something that we had advocated to CMS to explicitly clarify that therapists could furnish those services, e-visits, in last year's fee schedule proposed rule that actually came out in July of 2019. And in the final rule that followed up to that proposed rule, CMS basically said, no, therapists can't use these codes. Then on March 17th, in light of COVID, you saw CMS announce, okay, therapists, you can bill e-visits. So we developed a lot of guidance related to that, and recognizing that CMS really hadn't put out a lot of information related to the e-visits, we were a little, scrambling to try to find information about those codes. beyond what was in the code descriptor. We put out a lot of information related to those codes, and on March 27th, so 10 days later, you saw the CARES Act was enacted and signed into law. And within the CARES Act, there was authority that Congress granted to CMS to allow them to waive restrictions on telehealth under the 1135 waiver authority that I mentioned earlier, which had not had any sort of telehealth provisions in it. So through the CARES Act on March 27th, CMS then was granted authority, not requiring them to, but granted them the authority to make changes in relation to who can furnish telehealth, et cetera. And so several days later, on March 30th, you saw CMS release an interim final rule and some accompanying fact sheets. And the fact sheets that accompanied this interim final rule, which I'll explain in a second, had the language related to telehealth and codes being covered under telehealth and an expansion of codes being covered when furnished via telehealth. And there were PTOT and SLP codes added to the list of services covered when furnished via telehealth. And the way they phrased it in the fact sheet, they described it as physical therapy services are now covered when furnished via telehealth, caused a lot of confusion because of the way they phrased it. And in the interim final rule that accompanied this fact sheet, CMS went into further detail and said, although we're adding PTOT and SLP codes to the list of services covered when furnished via telehealth, we don't actually have the authority to add therapists as telehealth providers who can furnish these services via telehealth. Now, CMS said that in the interim final rule that came out on March 30th, which was 3 days after the CARES Act was enacted, giving them the authority. Well, they said that in the rule because they actually had drafted the rule weeks prior, because it takes them a long time to draft a rule and then send it over to an office within the White House called the Office of Management and Budget, Office of Information and Regulatory Affairs. That office then has to review the rule for accuracy and economic impact, and then transmit it essentially back to the agency that wrote it, CMS in this case, and then CMS publishes it for public view. And so because CMS had written that rule before the CARES Act was enacted, they didn't actually have the authority at that time of writing it to add therapists as telehealth providers. So that is,
So, excuse me, Cara, quick question there for clarification purposes. So even in an emergency basis, they did not have the authority to do it. Even for the period of time of COVID-19 or because of COVID-19, they did not have the authority. When I'm saying they, I mean CMS did not have the authority to do a temporary authorization of PTs as telehealth providers.
Correct. So until, even in this emergency, they didn't actually have any authority to actually add therapists as telehealth providers until the CARES Act was enacted, giving them that authority. And I'll explain this further in a second. So obviously there was a lot of confusion. We've been trying to communicate to the profession that although they added the codes to the list of services covered when furnished via telehealth, which is a great first step and is preparing the situation for if and when CMS does add therapists as telehealth providers, it obviously still is limiting because therapists who furnish more than 90% of these codes are not actually recognized as providers of telehealth under Medicare at the time that this was going on. Now, I will say that after the CARES Act was enacted, giving CMS this authority, we then leapt into action and sent letters to various HHS leadership, including the secretary, the assistant secretary, the CMS administrator, the deputy administrator, the CMS staff who actually promulgate the rules to implement the authority that they're granted via Congress. We also did sign-on letters with ASHA and AOTA, as well as another sign-on letter with NASAL and NARA and ABTQI and AOTA. And we also initiated a letter writing campaign, which is still active, on this interim final rule that came out on March 30th, basically saying, okay, we recognize that you didn't have the authority when you wrote this rule to add therapists as telehealth providers, but you do now have that authority, so please take action immediately and use this authority that Congress has now granted to you. As of a couple of days ago, when I last checked, about 1,700 PTs, PTAs, students, and patients and related individuals have submitted comments urging CMS to add PTs and PTAs as telehealth providers. And that is in line with when this interim final rule was released. There is an accompanying 60-day comment period. So in addition to sending all of these letters to HHS and CMS leadership, we also wanted to have it formally on the record that the profession as a whole wants this change, in addition to the National Therapy Associations. We also, shortly after the CARES Act was enacted, we met with CMS staff to talk about adding therapists as telehealth providers. And they had indicated at that time that they were reviewing the CARES Act and the authority that had been granted to them, and were actively engaged in pursuing approaches to give therapy providers regulatory relief and flexibility. So as some of you on this call may have heard or attended in the past, CMS has been having these national stakeholder calls every Tuesday and Thursday. And inevitably on every single call, someone asks, when are you adding therapists as telehealth providers? And CMS always gives the same answer, that we're looking at it, we're actively engaged in pursuing something that will give therapists regulatory relief and flexibility. So fast forward, CARES Act enacted March 27th. The initial interim final rule came out March 30th. April 14th, remember how I said the rule has to go to the Office of Management and Budget for review before it can be published? Well, we saw another interim final rule was sent over to the Office of Management and Budget for review. And it's titled something like Additional Policy Changes and Revisions in Light of COVID-19, and it was written by CMS. And so it is this interim final rule currently pending with OMB that we hope, are optimistic, anticipate includes the telehealth policy changes that we've been advocating for, specifically the addition of therapists and hopefully also therapist assistants as telehealth providers during this public health emergency. So as soon as the Office of Management and Budget reviews this rule, like I said, the document will be published, and then we'll know what changes CMS is implementing, including whether CMS will be adding therapists as telehealth providers under Medicare for the duration of the public health emergency. Now, we expect that obviously this rule is being written in response to helping providers respond to COVID-19 and the challenges associated with it. So we expect that this office will review it and complete its review hopefully within the next several days. So it's possible that by this time next week, that interim final rule could be released, and it likely will be retroactive. We're not sure about what date exactly, but it likely is to be retroactive. And again, there will be a comment period so people can submit comments on it, but it will take effect immediately. It will be retroactive, and hopefully it will encompass all of the changes that we've been advocating for in relation to telehealth, including the question of whether institutional providers will be able to furnish and bill for telehealth on the UB04 claim, because under current telehealth policy, physicians and practitioners who furnish telehealth, bill for those services on a professional claim form. And so it's possible that CMS mimics that policy and just simply adds therapists, so limiting it again to just those who bill on the professional claim form. But recognizing that obviously a lot of facility-based providers bill for outpatient therapy on a UB04, and the question has come up, as well as a significant push for CMS to make this change. It will be interesting to see if CMS actually adds institutional providers as a distant site practitioner who can bill for telehealth, like CPT code 97110, on the UB04 under the Medicare physician fee schedule, because as the current policy is set up, it wouldn't allow for that. So CMS would have to make some sort of change to allow institutional providers to bill for those services. And so we expect them to address it either way, whether they're going to allow them or not. We're hopeful that they address that question in this interim final rule, because certainly a lot of institutional providers are hoping for that change. So,
Ara,
yeah.
quick clarification there, because a lot of people asking for that. Two questions for clarification. When do we expect that release to take place that will be indicating that, yes, you can start now retroactively billing for those services, for the telehealth codes, although there will be a comment period, a 60-day comment period? How soon do we expect that to be released?
So I think we could expect it within the next week, because they're under a time crunch to try to get it out as soon as possible, which is faster than normal, I will say. Usually they take at least 90 days, if not longer, to review. The previous interim final rule, they reviewed in about 10 days or so. So I'm hoping that this rule went to OMB on April 14th. So hopefully within the next week, they'll release it and make it retroactive immediately.
Okay, so we know who we're going to hold responsible now if it doesn't happen next week. All right. No, I'm just kidding. So, and the next question is, there is no determination yet of the retroactiveness of the period, correct?
Right. They haven't. They'll say in this rule what. Like I said, I very much expect that they will make it retroactive, and so they will clarify in this rule what date it's being retroactive to.
Okay, this is awesome information, guys. I mean, really, this is actually breaking news that you are bringing here. That is amazing. That's good news. And please continue discussing that, and also can you clarify whether this will be a permanent thing, or what are the actions that need to happen to take place to make it a permanent thing for the profession?
Sure. So I'll just say I'll talk for about one more minute, and then I'll turn it over to Justin to talk about how to make this permanent. So as we await this interim final rule, where the Medicare policy stands currently in relation to care being furnished remotely is that PTs in private practice can bill for the remote evaluation of a recorded image or video, G2010, virtual check-in, G2012, e-visits, G2061 through G2063, and telephone assessment and management services, 98966 to 98968. And we have a resource on our telehealth page under recommended resources. It says telehealth modalities, and so you can click on that and it goes into detail about the services that I just described. And just for clarification, their CMS makes the distinction between Medicare telehealth services, which they generally describe as that face-to-face real-time consult or treatment, versus these other services that I just described, and they refer to those services as communication technology-based services, and they don't consider them Medicare telehealth services. So just keep that distinction in mind when you're thinking about Medicare, especially because when Medicare refers to telehealth, they're referring to those services that you would bill using your typical 97,000 series codes, the 97110, et cetera. Versus these other non-face-to-face remote care, but that they don't consider under the category of Medicare telehealth. And they use this other descriptor, the communication technology-based services. So long story short, as soon as the interim final rule is out, we will obviously be announcing it via PT in Motion News and social media and updating our telehealth site. With all of the latest information. We'll do webinars. We're happy to come back to this town hall and give information. But in terms of, recognizing this is a temporary fix, hopefully that they implement very soon, we're still continuing work to make it permanent. And now I'll turn it over to Justin to share what we're doing to try to make sure that this telehealth policy change is permanent moving forward.
Justin, before you start, two questions, Cara. Question number one, in terms of actual reimbursement of these codes, is there any anticipated difference than what the in-house codes will be? And second question, is there anything that is happening or needs to happen from the side of CMS so that all Medicare intermediaries across the country, they have this information, they process these claims correctly?
Okay, so first question, telehealth services are under Medicare are reimbursed at the same rate as in person. So CMS has said that, so that should be good. And actually we expect also in this interim final rule, it's possible that they add additional CPT codes to the list of services covered when furnished via telehealth. The 3 national therapy associations submitted requests for additional codes to be added. So hopefully they will take our recommendations and have it hopefully propose to add these additional codes. But yes, reimbursement rate's the same. In terms of the MACs, the Medicare Administrative Contractors, they've not been, as I'm sure you're all aware, they've not been consistent in their processing of claims for e-visits and other services. I think the document that came out on March 30th that confused everyone also confused them. And we have emailed, I personally have emailed CMS multiple times and brought this up on a national conference call, as have other members, basically saying you need to ensure consistency in terms of communication to the MACs, because they're not even on the same page about how to reimburse for e-visits. So that is definitely a concern and something that we'll continue to bring up to CMS, because we obviously want these claims to be paid on time and in accordance with the guidance being shared by CMS that APTA is then interpreting. We're hoping that the MACs will be on the same page, because obviously we want that to be processed. So please know that I've been working on it in relation to the communication technology-based services, and I anticipate that hopefully, because it'll be similar in terms of processing for in-person CPT codes as the same as telehealth, it's just the addition of the modifier. Hopefully it will be less of an issue than these other codes that we've obviously seen issues with, simply because more attention is being given to telehealth than the e-visits and virtual check-in codes, et cetera. So I'm aware of it. We'll make sure, we'll do our best to make sure that CMS issues clear and consistent guidance to the MACs.
Excellent. Thank you, Cara. So Justin, so what do we need to do to make this change that is coming up permanent? And let's talk also a little bit more about future, not just CMS and Medicare. What else we need to do? Let's talk about that.
So yeah, what's interesting is that before the current situation, telehealth and getting a permanent policy on telehealth for physical therapy was actually one of the priorities of APTA. A couple years ago, the APTA Board of Directors, as part of their strategic plan, made a payment for telehealth services one of our strategic priorities. And so ever since then, we've been working both at the state and federal level to allow it legally by therapists, and then to make sure that we are going to get paid for it. And so as a result of that, it being a strategic priority, APTA, along with a number of other provider groups, the ASHA, AOTA, number of American Telemedicine Association, through our support behind a bill known as the Connect for Health Act. And this is bipartisan legislation that's currently in Congress. It was introduced prior to the current pandemic. And this legislation would provide a permanent solution by implementing a permanent waiver process for those for providers, everyone from physical therapists to speech language audiologists, OTs. And so we were already doing a lot of lobbying and pushing for support of this legislation. What happened when we saw in early March that Congress was beginning to work on the CARES Act, we saw that as an opportunity to really try to include the Connect for Health Act in the initial CARES Act. We knew that we were going to need a permanent solution for providers to be able to utilize telehealth. And so APTA, along with our friends at AOTA and ASH and a number of other groups, really pushed hard on Congress to include the Connect for Health Act in the initial CARES Act that was put into law on March 27th. Now, our understanding is that Congress initially almost did that, but then they pulled back and said, well, no, let's just give a broad authority to HHS to do a waiver program during the length of the emergency declaration. And so that's why in the CARES Act, we didn't see Connect initially. We are now seeing, we did see though that language that does give broad authority to HHS to add providers. And as Kara indicated, we are hopeful they will do that in the near future. Now, Congress is beginning work this week. Actually, as we speak, Congress is debating an interim supplemental package known as CARES 3.5, which is specifically focused on providing additional funding to some of the programs that they created in the initial CARES package, primarily the small business loan known as the Paycheck Protection Program, as well as providing additional funding for healthcare providers and facilities. And so that's a very short, very narrowly focused interim supplemental package, which we expect will be passed by the House today and probably signed later this evening by the President. But Congress has already begun work on what's known as COVID Phase 4. And you'll hear the terms phase a lot. Congress has actually passed 3 bills known as COVID Phase 1. That was the one in early March. Phase 2, shortly thereafter. The CARES Act is known as Phase 3. And what we anticipate is sometime in early May, maybe mid-May, that we will see what's known as COVID Phase 4, which will be another large package that will hopefully address a number of issues. And so APTA—
Justin, one quick second, quick second. Before you start talking about Phase 4,
yeah.
Let me ask a quick question about 3.5.
Yes.
Meaning today's package, okay? Yeah. $30 billion will be allocated to HHS, right? Or it will be allocated for providers who have treated Medicare patients. Do we have any information how these funds will be distributed? Will they follow same or similar methodology with the previous HHS money?
So that's a great question. Now, in the initial CARES Act, there was $100 billion set aside for this healthcare provider relief fund. And what we saw a little over a week ago was that HHS began distribution of the first round of that $100 billion pot of money. And so on that Friday, I guess it was 2 weeks ago, they began doing that direct deposits into those providers who were eligible. And those are primarily folks who were billing Medicare last year. And these are for providers and that are treating folks who have COVID, and HHS has interpreted that to be very broad. Now they still have $70 billion left in the initial pot of money passed by CARES. They did release this week that next round of distribution of that pot of money is primarily going to be focused on hospitals, and they're going to be looking at which hospitals have treated the most COVID patients. And so those hospitals that have a large COVID patient population will probably get more money than a hospital that has less. So that's where we're going to see that next round of distributions going. Now, as you pointed out, today Congress is expected to pass the 3.5 supplemental program. That adds additional money into this pot of money from the CARES package. How that money is going to be distributed, we're waiting for additional clarification. It is the intent. The language in this 3.5 bill is written very similar to the initial CARES Act, where they do say, healthcare providers, suppliers are eligible for this. And so we would anticipate and hope that money, we could see potentially another round of distribution to healthcare providers, including physical therapists. And so we were pleased to see that a number of providers, number of our members let us know that they did receive checks, direct deposits, and we are hopeful that once 3.5 goes through, we will see additional distributions. But stay tuned because we're eager to see Congress pass that today, and also eager for HHS to provide additional guidance on what they're going to do with that additional funding.
Good, thank you. So phase 4.
Phase 4 is currently under discussion, and APTA back on April 14th sent a letter from our president, Sharon Dunn, to every member of Congress, to the vice president, to the HHS secretary, outlining our priorities for the COVID phase 4 package. Now, we have a number of priorities that we want to have seen included in the next phase package, including additional support for small businesses, and particularly, we want additional support specifically for healthcare provider small businesses. There would be a separate fund for healthcare provider small businesses that they could apply to get extremely low interest loans and grants. But we're also pushing for a number of other things, including additional personal protection equipment, making sure that remains a priority. We're also asking for hazard pay for those physical therapists and physical therapist assistants who are on the front lines of the pandemic. We're also asking for inclusion of what's known as locum tenens. This is the ability for PTs to fill in temporarily for the shoes of another therapist. It's currently allowed in rural and underserved areas. We want to see that expanded nationwide. But we are a number, and finally, before we get to the Connect, we are also asking that Congress basically not implement those cuts to the 36 providers, including physical therapists, who are slated to get cuts on January 1st. But a big major aspect of our push for COVID phase 4 is, again, asking for the Connect for Health Act. We know that this has been something that was put on their radar back in March. We think that we appreciate the work that they've done so far in giving the authority to HHS. But again, as we reiterate in our letter to Congress and in our meetings with Congress, members of their staff, as well as our grassroots, we need a permanent fix. We don't know where we're going to be 3 months from now. We don't know where we're going to be 6 months from now. We don't know what's going to happen next year, what's going to happen with the second wave. And the concern is that right now there's so much instability in the healthcare system. We have situations, we're seeing folks who are recovering from COVID who are going to need extensive therapy for months, or if not years, or for the rest of their lives. And we also know that there are going to be folks who may not feel comfortable going back all the time for in-person visits because of what this pandemic has done. And so we need flexibility, we need options, and we need stability. And one way for Congress to do that is to provide a permanent solution for telehealth. And the way they do that is by adding the Connect for Health Act. And this is a policy that, again, a number of healthcare provider groups are also endorsing for the COVID phase 4 package, including AOTA, ASHA, audiologists, a number of groups. So this has a number of folks who are pushing for it. We know that there are members of Congress on both sides of the aisles, Republicans and Democrats, bipartisan support to do this. The question is, will Congress do this and provide for a permanent solution? I do want to take a step back and talk a little bit about the temporary waiver that was provided under the CARES Act, which gave broad authority to HHS to add additional providers. Now, I know we've all been kind of frustrated with the fact that they have this authority. We've been waiting for them to enact it. We know they have an interim rule. We're pretty optimistic that we're in it. But what happens if we're not in it? Well, to make sure that we have protection on that, Congresswoman Cindy Axne, a Democrat from Iowa, will be introducing legislation either later today or hopefully tomorrow, probably tomorrow, that would basically compel HHS to add physical therapists, occupational therapists, and speech language and audiologists to the emergency waiver. So basically, if this interim rule comes out and we're not added, there will be a bill already in Congress that will basically require HHS to add us at least to the emergency waiver. And so we'll have two bills that we'll be pushing for. One is, we want the long-term policy solution with Connect, but we also are hedging our bets in that if this interim rule comes out and we're not included, we have a bill that will also address that. But again, our focus has been, we are optimistic though that the interim rule will include PTs, and so that will allow us to focus primarily on the Connect Act as a permanent solution. So we have sent out some grassroots grassroots alerts on the Connect Act. If you haven't seen it, you can go to apta.org and look at the Patient Access Center, which is open access, as well as our Legislative Action Center, which is open to members, about our policy asks for the COVID phase 4, and particularly our ask that the Connect for Health Act be enacted. In terms of timeline for Connect, the fact that Congress, it looks like today or later this evening, that the 3.5 interim package is going to be done. That's great news because that clears the way for Congress to really focus on COVID phase 4. There was a concern that this was going to drag out till next week. That right now doesn't appear that's going to happen. So that gives them now the ability to focus on COVID phase 4. We would anticipate, nothing is ever certain with Congress. I would say early to mid-May, we will probably see this. I don't think it will be earlier. And the one variable is that if things start going off the rails because of arguments on certain aspects or items, or if politics starts coming into the situation, that could be delayed maybe till the end of May. But right now our focus is on Connect. And I do just want to say a special thanks to not only to those members of Congress who are sponsors and co-sponsors of Connect, but also a special shout out to Congresswoman Cindy Axne of Iowa, who has just been such a great supporter of the physical therapy profession.
Awesome. Thank you very much. And Cara, thank you so much for answering in the text, in the chat, all of these questions that are coming through. Justin and Cara, since I have the opportunity, I will dare to ask this question, which is, how about future planning strategy for direct access on Medicare?
Well, I'll start off and then to see what Kira has to say. So yeah, great question, because direct access is, again, another priority of the association. And, ever since APTA made that a priority and the House of Delegates said it was a priority at the state level, our first priority was to make it legally allowed under a PT license, because a number of state practice acts written back in the 60s and 70s had language that said you have to have a referral just to walk in the door. And so since then, we've been pretty successful in going into the various state PT licensure laws to eliminate that requirement for a referral. And so at a licensure level, at the state level, we have all 50 states and DC allow for some form of direct access to evaluation and treatment. Now we say some form because we have about 23 or 24 states that have what is known as unrestricted direct access, no problems, no issues. We have a couple states like Alabama, Mississippi, Missouri, that have some pretty significant restrictions in terms of who you can treat and for how long. And then we have other states like North Carolina, or not even North Carolina, Rhode Island, South Carolina, which have like a 30-day time limit or a 60-day time limit. So we have, from a licensure level, we've made a lot of good progress in trying to first get it legal. And now we're going back and removing those restrictions that are tied to those state laws that have restrictions. So like states like Alabama and Missouri, which have more restrictive direct access laws, they have legislation this year, or had legislation this year, that would have removed those restrictions. Now, the big issue, though, is great. You've made it legal. We need to get paid for it. And so that really is we had to make it legal first to then be able to go back and advocate for payment of it. We are working, I know our private pay staffers are working with state chapters to make the cases to the private insurers like Blue Cross, like Aetna, to make sure that they're willing to pay for these services when they're provided absent a referral. But obviously the big issue is with Medicare, will they pay? Now, under current Medicare regulations, you can be evaluated and can commence treatment, provided your state law allows it. And for so long as you get your plan of care certified within 30 days. Now, I said provided that state law allows it, because if your state law is more restrictive than Medicare policy, then you got to follow your state law first, which is one of the reasons why we first did a lot of focus on the state laws to clear those up, so that way the Medicare policy could be recognized and enjoyed by patients in all the states. But we did have a bill in Congress for a number of years that tried to fix this through legislation. obviously had some significant opposition to it. But we also are looking at regulatory relief to this, because the good news is that, there is a push now to relieve administrative burden, to get rid of some of these requirements that are just a hassle. And the current requirement of getting the plan of care certified is a hassle in many ways, and getting it recertified. And so we have had indications, that this administration is interested in looking at what are ideas that they can do through regulation that might relieve administrative burden. And this has been one of those issues. And so, Kara, I don't know if you have anything you want to add in terms of some of I know we've made some recent requests to the administration in terms of regulatory relief, and this was one of them.
Yeah, so I'll just add, on the regulatory side, in terms of CMS, particularly because this administration is so focused on reducing administrative burden, we have been pushing. I can't tell you how many letters we've now sent to CMS during every open comment period, as well as not during a comment period, to advocate to CMS that they eliminate or modify the plan of care certification requirement, simply because of the burden associated with it. And so, I think that obviously CMS hasn't made any changes yet. Actually, in light of COVID-19, we again sent our request to CMS urging them to eliminate or modify the physician certification of the plan of care requirement, because obviously they're trying to give providers relief and flexibility. So we did just actually recently reiterate that request to CMS. As Justin noted, there is opposition to it, and I think that both on the Hill and CMS, I think there's still just some overarching questions in terms of, well, the plan of care certification requirement, does it help to constrain utilization? Does it ensure there's some sort of physician involvement in the patient's plan of care? We all know that the physicians aren't, not we, but I've been told physicians don't really look at it. They just sign it and send it back. But certainly it would reduce administrative burden. And I think that it's possible CMS modifies this requirement in the future, but they haven't made that change yet. I think, for example, they might say, okay, you either have an order in the medical record or you get the plan of care certified. Since most Medicare beneficiaries are probably coming in with an order anyway, that would at least illustrate to CMS that the patient is under the care of a physician, because you have to think about the fact that it's not just that they're under, that a physician is periodically reviewing the plan of care, but that also the patient is under the care of a physician. Sorry, my dog. The mailman, I think, is here. So to comply with the statute, it's not just amending the plan of care certification requirement, it's also how to show to CMS that the patient is, for example, under the care of a physician. So I think that it's very possible CMS makes modifications in the future. Again, it would have to be in accordance with statute unless we are able to actually amend the statute through legislation. But we're pushing for it every opportunity. We've had members and non-members send letters to CMS during open comment periods, reiterating the same request. So they've heard us loud and clear that there needs to be a change to the plan of care certification requirement. It just now we're awaiting to see if CMS actually takes action on it.
Thank you. Go ahead, Justin.
Yeah, I was just going to add, right now we don't have current active legislation in Congress to address direct access. We took a pause on that about 2-3 years ago. But part of it is just the politics, looking at what are the political wins in Congress, who's in charge, and looking at strategy of, well, could we maybe address this through regulatory advocacy? But that does not preclude us or prevent us from doing future legislation. And so we're going to see, particularly after the election this fall, what are the political dynamics that might either help us or maybe advance the ball a little bit further down the road in terms of potential legislation. But yeah, this continues to be a big priority for us.
Awesome. Before I thank you guys and I close it, I want to make three quick announcements. Announcement number one, based on the information I'm listening to right now, the breaking news we had during this meeting, I have decided that next Thursday, instead of starting the How to Rebuild Your Practice series, we are going to run another question answer meeting. We're going to have hopefully Mary DeLong, who she is with us here today, but she didn't have the chance to talk. We'll have her hopefully with us, and we'll figure out what other speakers just to get more of your questions answered. So to register for that, go to savephysicaltherapy.com and you'll be able to get also, hi Mary, you'll be able to get also other information for past webinars. Second announcement is that tomorrow, Friday, there is an amazing free event for private practice owners by the group of Chad Madden and Breakthrough Physical Therapy. I'm posting the link right now for you to go and register for that event. It's a free event. It's pretty amazing. HUDs will be participating. There are over 1,000 private practice owners that are participating in that event, and HUDs will be there and will be attending that event. And number three, there is also another amazing one-day event by Survival Strategies and Tim Mantis. Tim, you have the forum for 15-20 seconds to just talk about your event and share the link with us.
Okay, great. Thanks, Dimi. And thanks to you guys from APTA. Really great information, really informative. Thank you so much for attending. Survival Strategies is a training and consulting company. We've been helping people in private practice since 1985. And this Saturday, Paul Savlosky and I are going to be leading workshops. It's one day, it's $199. You're going to learn all the basics from our book, The Keys to Private Practice Success. So it's for you guys to help get through this time period. It's pearls for peanuts, trust me. Mimi knows, he's done a lot of work with us. So I'll put up the link and you guys can go on with your meeting.
Thank you, Tim.
Thank you.
Cara and Justin, thank you guys so much. You are amazing and you gave, oh my God, the whole history. Now we have the whole picture. Thank you so much, and definitely I'll reach out back to you in a couple of weeks to join us again so you can give some more information to everyone. And guys, also join the grassroots effort, pt4heroes.com. Please go there and help some of these first responders and post your stories there. We love you all. Take care.
Hi, everyone. Thank you.